Hello everyone, I welcome you today on this platform of KNYA Voice. KNYA Voice is an initiative by KNYA Med where we want to share some empowering conversations with the doctors which will help them not only in just their regular life but also in their medical profession. So on the same note, today we have with us Dr. Devashish Palkar sir. He has completed his MD Psychiatry from GMC Surat in 2021 and is currently working as a senior resident consultant in Psychiatrist at Government Medical College and New Civil Hospital, Surat. So today I welcome you, sir. We are very much, happy to have you here on this platform, and we wish that today we can guide the doctors as well.
Thank you so much, Akshat, for having me. This is a great initiative that you are taking, and always a pleasure talking to you.
Right, sir. Thank you so much, sir. So to the audience, we must tell that what is basically KNYAMed. We are basically a platform where we provide comfortable medical apparels for all the doctors, right from their lab coats to the scrubs. And the main, utility is that it is technologically backed, as well as there are many institutions in the country, around 500 plus hospitals, which are currently powered with us. So today we will discuss a very important issue with sir, that how, mental health, everything for doctors, like how they should be aware of their mental health, how they should take care of it, and when they need some kind of help, they should reach out. So sir, I think we shall begin with the topic. Before that, if you have any introduction words for our audience, we would like to listen that.
Yes, Akshat, I think we should begin with the session, and whatever questions that audience might also have, they can just write to us in the comments, and I would be more than willing to help them find the answers for the same. And we can go ahead with it. Yeah.
Thank you so much, sir. So the first question that everyone, expect is that basically doctor profession is a very hectic and energy consuming profession. So now how can one revive himself or herself even in this profession? Because there is, there are so many things to do and the time is limited and this needs to be taken care of. So how to revive oneself?
See, Akshat, from giving our 12th standard exams to
Right.
finally coming out as super specialist, it takes around 12 to 15 years of an individual's youth. Now, this is a very crucial period in anybody's life. This is a period when all other contemporaries, like from engineering or architects, they are settling up their careers, they are getting married, they are earning much more than what we are earning. So this is a very crucial period of time for us as medical students because we are still students by the age of even 30. We are still learning. We are trying to educate ourselves so that we will be able to help our patients more and more. And it can be frustrating at times. It can be very stressful because of the competition associated with our field and also because of the level of excellence that we need to achieve, because of which that can be a lot of stress. And as you said, it is important for us to revive ourselves. And the easiest way to do that is to understand that there is to life beyond our medical curriculum as well. Sometimes when we are so trapped in this kind of a system, we begin to feel that this is education, this patients, hospital is all that we have. But we need to look beyond the four walls of our hospital and to find joy and meaning in our life as well.
Right. Definitely, sir. It's very important to introspect at every step and to know that it is not everything that you have. It is just a part of, the regular life. So, right, sir. On the similar note, often doctors are expected to be healthy mentally all the time. Like even, एक surgeon है उसको कल surgery करना है तो one cannot expect कि उसको कुछ issue हो रहा होगा, right? So now one thing is that first of all, it is very important for doctors to seek help from psychiatrists, because usually people think हम तो खुद डॉक्टर हैं, हम किसी और डॉक्टर के पास क्यों जाए, right? So how one should remove that stigma so that one can ask for help?
See, like any other medical disorder, we as doctors are also human beings and we are equally vulnerable, or rather I should say we are more vulnerable to all medical disorders because of the stress associated with it, because of our poor dietary intake, because of our poor lifestyles. So we are rather more at risk for all other medical disorders because we are constantly exposed to patients. Similarly, with case of mental health disorders, when we start to understand that all the mental health disorders have a neurobiological basis to it, it is not that you are doing it voluntarily. See, nobody would want to suffer from fever or want to suffer from diabetes or cardiac arrest voluntarily, right? We
Right.
cannot control our heart rate. We cannot control our blood pressure voluntarily. In a similar way, we cannot directly, consciously control our thoughts and emotions and all that is going on in our brain. See, brain is the least explored area of our or least explored organ of our body, and the most important one. Yet we think that we should always be in control of our brain, but it is not practically going to be possible. Just like you may have a malfunction of your liver or your kidney, similarly, your brain may also get tired, may also fatigue, and may also malfunction at times. So it is important to understand the neurobiological origin of it. Maybe then we can reduce the stigma associated with psychiatry.
Right, definitely, sir. So now on the similar note, that many a times there are night shifts, there are hectic round duties. Doctors eventually have to take medicines for anxiety to get, proper sleep at night. Do you think this is worth it? Because at times what happens is they feel that this can, better off the situation, but in the long run, I think this is not something which should be done. So what do you think of the situation of the temporary solution?
See, Akshat, as you said, there are going to be times, especially in residency, internship, wherein there are hectic duties, night duties also, where we are, putting in constantly 24 hours and even sometimes 36 hours duties. And it is definitely going to take a toll on our stress levels, and it is going to increase our stress levels, anxiety levels, and many people become vulnerable to all sorts of psychiatric disorders as well. At that point of time, it is important to realize that one should not self-medicate himself. Many times we see that residents are by themselves taking alprazolam, clonazepam, or any other sedatives just so that they can sleep properly. Now, it is something that I would never advise, because just like whenever you suffer from any disorder, you visit a specialist, you seek his consultation, and then only start the medication. Similarly, with case of mental health disorders. So, if you are suffering from anxiety, if you are having difficulty sleeping, then it is best to approach a psychiatrist. And the best part is that in our hospital setup, there is obviously going to be a psychiatrist setup available to you. There are going to be your friends or colleagues who are doing residency in psychiatry. The best way is to approach them directly rather than secretly taking these pills, because they can lead to potentially that can lead to adverse effects, and also it has an abuse potential as well. So we need to keep that in mind as well.
Yeah, sure, sir. So it is very important to, address that problem that, there is nothing temporary solution, and avoid self-medication, be it any level of, problem it is associated with. So, usually doctors are expected to bear any sort of circumstances just because they are in the profession, right? Like from their medical school, they are trained in such a manner that they have to face everything. So on that note, sometimes we also feel that, okay, we are some sort of superhero, but then superhero also have their weaknesses, right? So could you give a message to our audience that they can know that yes, doctors are human beings, we need to treat them like normal human beings, and they are not some robots, and even robots can at times need rest. So on that note, what will be your message to the audience?
See, Akshat, as doctors, we have got this wonderful opportunity to be of service to people. And sometimes, we might feel overburdened with this sense of responsibility. We might start to feel that everything depends on our hand and we can save the patient, or if we make a mistake, then the patient might die. But actually, if you look at the larger picture, then it is not so. We are just one instrument, we are just one part of this large thing called life. We are trying our best to help the patient. And see, not everything every time is in our hands. Even the best surgeon can make a mistake, even the best physician can miss a diagnosis. And it is natural for humans to make a mistake. So be gentle on yourself, be kind to yourself, and understand that you are humans too. So if you take care of yourself first, then only you are going to be of value to society. A doctor who is himself not physically and mentally healthy, he cannot help other people as much as he wants to. So first is to take care of yourself, and then only to serve others. So that is how I would say.
Right, definitely, sir. So it is very important to also take care of yourself first before just always thinking about the patients or the mistakes that one commit in day-to-day life. So, sir, what are some basic tips, if I should sum it up, that doctors should follow to keep their mental health sane amidst the high burdens of their duty, be it like meditation, taking out self time, and how to do it, and as well as you can tell about your residency, like whenever there is hectic duties, how do you manage keeping yourself sane?
Yeah, rightly said, Akshat. See, in life, the purpose of anything that we do has to ultimately give us some sense of happiness. So whether you are treating patients or whether you are not treating patients, if it is not rewarding to you in terms of happiness, in terms of your emotional health, then however amount of money that you generate out of the profession, however amount of successful surgeries that you do, it is not going to be of help to you. So first and foremost is you should be in a field which gives you happiness. And it is crucial after internship to decide which field the person can stay for his life. So someone who is interested into surgery, definitely only then he has to go into surgery. He first of all needs to understand which field he should choose for the rest of his life. That is important. Once the field has been chosen, he has to understand that there are things beyond that field as well. So most of the successful doctors, most of the happy doctors I've seen around myself, around me as well, they are doctors who spend quality time with their patients, but also have their own personal life. So they do all sorts of activities which give them pleasure as well. Be it meditation, be it running, be it painting, be it dancing, be it writing, be it acting. So hobbies are something that give us pleasure, and we should not forget that. In psychology, we say that our day should be scheduled around three main activities. First is the activities which give us a sense of some achievement, and when we derive some sort of achievement through the job that we do. We are blessed, we are given this opportunity to touch up someone's life and to help them come out of it, come out of any illness. So that is a sense of achievement that we get out of our job. Then comes the sense of pleasure. So for the sense of pleasure, you should seek out experiences like music, traveling, reading your favorite book, watching your favorite TV series. All these are also important aspects of life. And the last is activity which gives us connection. Finally, at the end of the day, we should realize that we are humans, we are social animals. So a connection is very much important. Many a times during residency, we might feel isolated, we might feel alone because we are spending long hours, night duties, hectic shifts. So we are disconnected from our families. Most of us are staying at hostels. We do not interact with our school friends. So that should not be done. Try to incorporate some amount of time so that you are connected to your loved ones, be it even two people or three people, but you should constantly interact with them, share your day-to-day experiences, because many a times there are bound to be experiences where we feel frustrated, where we feel stressed, and we need to talk about stress. If we keep the stress in our mind, then it just keeps on building up, and it can lead to various psychiatric disorders like anxiety and depression. So have a good friend whom you can talk to, have your parents who you can listen to for advice. So that is very important. So these three aspects of life, activities that give you a sense of achievement, activities that give you a sense of pleasure, and activities where you feel connected, these are very important aspects in a day-to-day life.
Right, definitely, sir. So first of all, one need to know that the profession, the branch they are in, they should absolutely love it so that they could get that achievement, and also strive a balance that you can't just keep going in the competition. You need to take out some time for yourself as well. So now, sir, as you might have heard that doctors are not doctors are the worst kind of patients, right? So now you can could you please guide our audience that what are the kind of mental health issue a doctor can face, maybe in his residency, maybe in his practice. Nowadays there are also very assault cases that are being reported with doctors, so there can be many mental health issues. And what are the as we say, warning signs that one should stay alert and free to talk openly about it?
If I look in my OPD itself, then there are many medical students, many postgraduate residents who come to us for counseling, for treatment. And amongst them, if you look at the most common ones are related to anxiety, related to burnout, related to insomnia. And all these happen because of the stress associated with the academics, the stress associated with the long duty hours, wherein the person does not get to sleep most of the days. So first year of residency, the internship, these are very crucial periods wherein the individual is most stressed. And the warning signs of any mental health disorder generally start with, decreased sleep, decreased appetite. Person starts to feel low. He starts to feel disconnected. He does not get pleasure out of all the routine activities which he was initially getting. He starts making mistakes in his day-to-day activities. So, for example, a surgery resident who has had hectic duties in the last week, he might start making mistakes at his surgery. The boss may yell at him. That could add up to the burden, that could add up to the stress levels, and finally he might land in our OPD with anxiety, with depression, with burnout. And there are cases where we need to even give medications to them, where we need to even admit them in our wards, and we counsel them as well. So you should not be afraid, you should not have any stigma associated with seeking help, because taking care of yourself is the first and most important priority. The best patient that you can treat is yourself first, and then only you can convince others to seek treatment and to help people.
Right, definitely, sir. So it's the ultimate message is कि सबसे पहले खुद की सेवा, right? उसके बाद आप जितनी सेवा कर सकते हैं, सबसे पहले जब आप खुश रहेंगे, you will be in a balanced state, so you can take care of your patients as well, and you will not have that burden of committing mistakes or whatever guilt that you have due to it. So sir, if we conclude the whole video in say 2 to 3 points, the conclusive points that you want to address to our audience in the rising problems of mental health among doctors particularly, and also which can help them in their regular life, so what would be that 2-3 keywords?
See, stress is going to be a part of our life throughout our medical journey and even after we graduate, postgraduate. So dealing with stress is something that an individual has to find it out for himself. What are the activities that give him pleasure? What are the activities that de-stress him? Find out that one activity and stick to it for life. Be it meditation, be it listening to music, be it exercising, but be committed to that activity because that is the kind of activity which will give you the relaxation that is needed after hectic hours of duty. And if you are not able to find that, then many a times it can lead to a lot of stress, a lot of frustration. And all this frustration can eventually lead us to committing mistakes as professionals as well. And we don't want to do that. We do not want to, make mistakes while treating patients, while diagnosing. And it can even lead to sometimes arguments with patients because we are so angry, we are so frustrated, we are not in charge of our emotions. So all these things should not happen. Because of that, we need to find some area of life which gives us pleasure, which gives us meaning apart from the four walls of our hospital.
Right, definitely, sir. So I guess this session must be very helpful for our audience. In this, we came to know about many mental health issues that a doctor can face, and also most importantly, the thing is to report. It is very important to seek out help. So Dr. Devashish Palkar sir is doing an absolutely amazing job on his Instagram handle as well as Twitter handle. I will mention all the links in the description. If you have any query, if you face any issue, you can surely either comment below or you can DM to sir on his Instagram handle. And I hope he will continue to guide us in this entire journey as well as supporting the new initiative of KNYA Voice. Thank you so much, sir. It was a pleasure to have you here.
Thank you so much, Akshat.
Thank you.